Good morning. So here in this presentation, we will talk about the hepatoid adenocarcinoma in stomach and duodenum. So what is hepatoid adenocarcinoma? So it is a rare and aggressive type of cancer that can develop in different organs like the stomach or esophagus. It is tricky because it is hard to detect because its symptoms are similar to the regular stomach cancer. So, they also share similarities with hepatocellular carcinoma. So, HAC shares many similarities with HCC, which is a type of liver cancer. Both of them have similar appearances under the microscope and produce the alpha fetoprotein, a marker commonly associated with liver cancer. The similarity in appearance and marker production can make it challenging for doctors to distinguish between the two types of cancer. So, however, while HCC originates in the liver, HAC can develop in various organs outside the liver, such as the stomach or esophagus, so and have a poorer prognosis compared to the HCC. So, um, why it is important why it is important for early diagnosis, because it can grow fast and be tough to treat once it spreads. So in tests, doctors look for a certain markers like SA, cell-like protein 4 or SAL4 and alpha fetoprotein to help diagnose HAC, but they might miss how these markers affect the cancer's growth and the patient's chances of getting better. So, in the journal, it stated there the patient's history. So, the patient has been living with a chronic hepatitis B virus infection for 30 years. So, chronic hepatitis B infection can increase the risk of developing liver cancer over time. Why? Because it attacks the liver, leading to inflammation and damage over time. So, the patient was admitted to the hospital due to the elevated serum level of AFP. As I stated a while ago, AFP is used as a marker for detecting liver cancer. So, in this case, the significantly high level of AFP in the blood of that patient raised suspicion of liver cancer. So, the doctors make a further examination, but that further examination showed no obvious symptoms upon physical examination, and most other laboratory tests were within the normal range. So, despite testing positive for HBV, surface antigen or HBsAg, the level of HBV DNA in the blood was lower than the prescribed minimum of the test. So, based on this report, the patient was suspected of having a primary liver cancer or HCC. He underwent imaging tests such as CT and MRI scans to confirm the initial diagnosis, but this revealed no liver tumors, but did show an abnormal thickening and enhancement in the pyloric area on their CT scan, along with the hepatic portal vein and left gastric vein shown by both CT and MRI scan. So, PET-CT imaging showed increased activity in the stomach and duodenum. Endoscopy further identified irregular masses in the stomach and a deeply ulcerating mass in the duodenum. Pathological examination of tissue samples confirmed the presence of poorly differentiated adenocarcinoma, a type of aggressive cancer in both locations. So, next generation sequencing. So, to understand the tumor's molecular profile, next generation was performed. So, NGS is a technique used to analyze the genetic makeup of tumors. In this case, it identified mutation in several genes, including ones related to the notch signaling pathway. So, while common mutations associated with this cancer type With this cancer type were not found, the involvement of the Notch signaling pathway suggests potential avenues for targeted treatment or further research. So, in the journal, the patient received empiric therapy. So, empiric therapy means giving a treatment that is commonly used for a certain condition without knowing the without knowing for sure if it's the best option. So, in this case, the patient received a combination of medication to treat that patient's cancer. So, how was the patient response to the treatment? So, after receiving after receiving the treatment, follow-up scans show that the tumor size decreased and other levels of AFP or a marker of liver cancer dropped significantly, so indicating that the treatment was partially effective in shrinking the cancer and controlling its growth. So, what is the benefit of regular follow-up examination in this patient? So, after treatment, the patient continued to have a regular checkups. So, with doctors to monitor his condition. These follow-up examinations help ensure that the cancer is under control, detect any potential recurrence early, and adjust the treatment plan as needed. So far, in this journal, the patient's quality of life hasn't been greatly impacted, and he remained alive. So we will go to the discussion of my critic paper. So here we will talk about the involvement of both stomach and duodenum, challenges in diagnostic, lack of targeted treatment options and combination therapy, and importance of understanding the genetic foundation. So here, in this case, um, there are two organs that are affected. So typically kasi, cancers tend to affect one specific area of the body. Like I said before, hepatitis adenocarcinoma showed up in both the stomach and the duodenum, which are parts of digestive organs, which are parts of the digestive system, I mean. So, this makes the case unique and presents challenges in determining where the cancer originated. So, identifying the exact location of cancer in this case was difficult because it looked similar in both the stomach and the duodenum. Additionally, interpreting certain tests like immunohistochemistry staining, which helps identify a specific proteins in the cancer cells, required expertise due to the similarities between hepatoid adenocarcinoma and the other types of cancer. So, unfortunately, there isn't a single treatment that works effectively for hepatoid adenocarcinoma. So, however, doctors found that combining different treatments such as chemotherapy, and targeted therapy, which focuses on specific molecules involved in cancer growth, showed promise in managing the disease. So, what's the importance of understanding genetic foundation? So, scientists are investigating the genetic basis of hepatoid adenocarcinoma to uncover new insights into how the cancer starts and progresses. They discovered that a signaling pathway called Notch signaling might be crucial in the development and growth of cancer. Understanding this pathway better could lead to development of more targeted treatments. So, the aggressive behavior of hepatoid adenocarcinoma, coupled with its tendency to spread to nearby lymph nodes, and it contributes also to its poor prognosis. Knowing how the cancer behaves and spreads help doctors make informed decisions about the treatment options and improve outcomes for the patients.